Hello class and welcome to week 2 of our course. This week we're going to be focusing on depressive disorders and anxiety disorders. Now the poem that I selected for us for this week is actually one that used to be in the office of my guidance counselor when I was in high school. And that poem has always stuck with me to the point where, this was before Google and really the internet as it is today. Such that, by the time that I finished school and was in my doc program, I was like, what was that poem that was in the guidance counselor's office? And I remembered, the title, To Santa Claus and His Little Sisters, and I just Googled it. And to me, I think this is a poem that sort of highlights what you see and what we deal with in the field when it comes to depression. What can be an eventuality of depression if there is no intervention, which is suicide. And so some of you might even recall the suicide demo, an assessment that took place while you were at your residency back in September. But this week, you have some good videos on depressive disorders and anxiety disorders. You have those sections in the DSM. And what I will encourage you to do when it comes to depression and anxiety and the different nuances, always think about frequency and duration. So how long has the individual been suffering with these symptoms and how often? And so sometimes that can help us to narrow down where we're going to go. I know a client of mine in particular that I had when I worked in a college setting. He was one of my first with really severe depression. And it was a pretty long-lasting event from the time that he was a young male all the way up into his freshman year in college. And so depression can look like many things, as we know, and anxiety and depression are often put together because there is a lot of overlap between the two. Consequently, that is one of the topics of your journal, talking about depressive disorders and anxiety disorders. And it also goes to your final case study that you saw this case when you were in your assessment class last term, or in your assessment class. And so what you're going to do is do a journal this week and also complete a biopsychosocial form. It's also called a psychosocial form, depending on where you live. And this is an important document because it gathers a great deal of information about a client. And so it helps us to form a case formulation when we have this information about a client. And when I would teach my students, if you get overwhelmed by the amount of information that you're gathering or piecing together, just think of the three terms. You have the biological, you have the psychological, and you have the social. And when you have this information, this historical information about a client, both historical and current, it really does give you a good idea of what's going on and sort of what directions we can go with our treatment. So that's our announcement for this week. I look forward to reading your journal entries, and I look forward to working with you on the biopsychosocial and as we work through this complicated case. Let me know if you have any questions or concerns. Thanks.